The brain is the central hub that controls and regulates everything in our body. Every thought, feeling, and movement originates from the brain. Consequently, any damage to the brain can lead to severe symptoms that make daily life nearly impossible. Unfortunately, as we age, the brain also deteriorates, leading to various diseases. In particular, stroke is a serious condition with an increasing incidence. While strokes are commonly associated with the elderly, recent years have seen a rise in younger patients. Even with successful recovery, most stroke patients struggle with symptoms, both major and minor, and physical disabilities often persist for a long time. I once treated a young female college student who was hospitalized due to a stroke. The severity of her condition, which could result in lifelong disability, was a devastating reality for someone in her early 20s. With my extensive experience in stroke treatment, assessing and treating her physical functions wasn't particularly challenging. However, I felt deep compassion for her, knowing she would have to live with a physical disability at such a young age. When I first saw her in the physical therapy room, barely able to sit upright in a wheelchair and leaning to one side, I couldn't help but wonder, will this patient ever recover? My concern must have shown on my face, as both she and her parents looked extremely anxious. After assessing her condition and creating a treatment plan, I did my utmost to treat her. Thinking of her future, so young and full of potential, I couldn't do otherwise. Remarkably, after treatment began, she improved at an astonishing pace. Her condition was noticeably different between morning and afternoon sessions. Whether it was because the damaged area was relatively small, or because her youth aided her recovery, I wasn't certain, but her progress was undeniably faster than that of other patients. Perhaps because of this, she was more proactive in her treatment than anyone else. Within about a month, she went from struggling to sit in a wheelchair to standing on her own and taking slow, deliberate steps. Unfortunately, she could barely move her hand. The inability to use her hand properly made daily life significantly challenging. From that point on, we focused greater effort on restoring her hand function. We practiced various hand movements repeatedly, carefully exercised her arm and hand to prevent stiffness, and applied electrical stimulation to individual muscles to help her wrist and fingers regain strength. Despite these efforts, unlike our expectations, her hand function showed no signs of improvement. I held on to hope that time might bring progress. But having seen many stroke patients struggle with hand function long-term, I couldn't help feeling somewhat discouraged. Careful not to let my disappointment show, I greeted her warmly and completed her Saturday morning treatment. After work, as usual, I set aside my worries and enjoyed time with friends. On Monday morning, as I was organizing the physical therapy charts at work, she came to mind. I vividly recalled the treatments we had done the previous Saturday and her condition at the time. Thinking of how she had recovered enough to walk with a cane, I briefly pondered, how should we approach her hand therapy today? As she entered the therapy room, and we began practicing various exercises on the mat. Preparing to work on her hand movements, I was utterly shocked. Though not fully normal, her hand was moving remarkably well. Just 2 days earlier, she could barely move it, yet now she could eat, dress, and wash herself independently. I was incredibly curious. What had happened over the weekend to cause such a dramatic change? When I asked her, she explained that her boyfriend, who was serving in the military, had visited her during a brief leave. Deeply concerned for her, he had spent 10 minutes tenderly massaging and rubbing her hand. From that moment, she said, her hand began to move as if by a miracle. Her unexpected answer caught me off guard, but as I pictured the scene, I couldn't help but smile faintly. In my long career as a physical therapist, I had never encountered anything like this. It made me reflect deeply on my approach to treatment. Have the treatments I've been providing truly been effective? Patients, in their struggle to heal their ailing bodies, try countless methods and desperately hope for positive outcomes. This suggests that many factors can influence results. Perhaps the earnest gaze, loving touch, and the patient's desperate will had a greater impact than the treatments I provided. This miracle, brought about by the power of love, might not be mere coincidence. Ultimately, she recovered to near normal function and, just a month and a half after her admission, walked out of the hospital on her own 2 feet. Treating her taught me so much. How much do I really know about the events happening around me? Is what I believe to be right truly correct? These questions prompted me to reflect on myself anew. I don't know where she is now or what kind of life she's living. I only hope with all my heart that she's healthy and faintly remembers our connection. Invisible bonds and inexplicable forces always influence our lives, and physical therapy is no exception. For this reason, a physical therapist must remain humble. I vow not to fall into the folly of ignoring the truth beyond my knowledge. Intoxicated by the allure of expertise, I am sincerely grateful to her for this profound realization.